My name is Kevin Rooker. I'm a clinical marketing specialist here at Citco Medical Solutions, and today I'm going to demonstrate for you how to assemble the AccuSITE Needle Guide. The AccuSITE Needle Guide is a little unique in that it is for out-of-plane needle placement procedures. So first, we're going to attach a reusable, non-sterile bracket. Now, each probe has a unique bracket designed for it. There are locating features on the bracket as well as on the probe. So we'll line those two up, and then the bracket will snap into place. I'll put it back in the holder for now. Next, I'm going to open the Sterile Procedure Kit and drop it onto my sterile field. Now I've put on sterile gloves, so the rest of this will be a sterile technique. Open the package. Inside you'll find several things: sterile gel, a sterile probe cover, elastic bands, and then the AccuSITE Guide tree that has several depth selections. I'll explain more on that in just a moment. First, I'm going to put gel onto the transducer. You can put gel into the probe cover itself prior to putting it on. That's a personal preference. I prefer to put the gel on the probe itself. So gel right there on the end of the probe. Then I will take the probe cover, place my hand in the middle, and grasp the probe, take it out of the holder, and pull it down the length of the cable. Then use the elastic bands to secure the cover. So each AccuSITE kit comes gauge specific. So you'll notice these are yellow, that's for 20 gauge. I'll decide in a moment which actual gauge I will use because it's dependent upon the depth of the target. If you look at the numbers on each of these, they're specific depths. So if my target is 2 centimeters deep, then I would choose the 2 centimeter guide, and it attaches on the outside of the cover, like so. So the next step will be to actually scan the patient. Today, obviously, we're going to use a phantom, but I will want to scan while watching my screen over here and locate the particular target. So for today, I'm going to go for this nerve right there. So I notice that it's 1 centimeter in depth. Now, some systems have software that will actually put a center line on here, which is what I've done today. And each one of these is at 5 millimeters. You also have depth markers over on the side of your image. Or you can actually do a physical measurement to check the depth. But when using the AccuSITE Guide, we need to know how deep we're going. So this is at 1 centimeter. So then I will choose the 1 centimeter size guide and attach it to the bracket on the outside of the cover. And then I'll scan again to my target. Then I'm going to introduce the needle. And the first reflection I see will be at 1 centimeter, right there at my target. Once the needle's in place, if I want to remove the probe from the field, I just push the quick release tab on the side of the guide. Then I can remove the transducer and the needle stays in place. Thank you for watching. If you have any additional questions on how to use the AccuSITE Guide, please use the contact information you see there on the screen.